Human trafficking is often referred to as modern-day slavery, a violation of human rights that affects millions of people across the world. This crime does not discriminate. It crosses national, cultural, and socio-economical borders, leaving a devastating impact on individuals, families, and communities. Human trafficking is a local, state, national, and global crime that involves the legal trade and exploitation of individuals for various forms of forced labor, sexual exploitation, and other forms of abuse, affecting millions of men, children, and women around the world. Traffickers often use violence, deception, and coercion to control victims, trapping them in situations where they are exploited for profit. Efforts to combat human trafficking have grown within governments, international organizations, and advocacy groups at the local, state, national, and global level, working to raise awareness, support survivors, and bring traffickers to justice. However, due to its hidden nature, this crime is very difficult to discover or stop. In this presentation, we will explore effective strategies for educating, preventing, and supporting individuals affected by trafficking. We will examine how trafficking challenges our ethical and moral values, and will also review the programs, laws, and policies currently in place that advocate for reducing the prevalence of this global crisis. Through this, we aim to deepen our understanding of the issue and learn how we can contribute to a meaningful change. Thinking about the ethics involved in human trafficking, healthcare professionals need to effectively provide care to victims of human trafficking brought into local hospitals. So us working in the Fort Wayne area or in our local areas or just in the state of Indiana in general, providing care to traffic survivors or individuals brought in by their human trafficker. We need to understand that human trafficking violates a person's rights, and it definitely leaves physical and psychological consequences. So when we're providing care to these individuals who have been harmed through sex trafficking or labor trafficking, we need to respect a patient's needs, wishes, goals, priorities, and understand that they're at a greater risk and highly vulnerable during this period of time. We really need to uphold the principle of autonomy, give the patients the right to their care. They're very scared. They have lost all autonomy in other areas of their life, so we really need to give that back to them. Also, our focus is to do good for these patients and not to cause more harm. So we need to focus on establishing a trusting relationship. To do this, we're able to provide quality care to these individuals. And we should really utilize the trauma-informed approach so we can recognize the widespread impact of trauma, recognize signs and symptoms of trauma. We're able to know the policies, procedures, and practices involved in this kind of trauma, and we are able to take care of these patients without causing any sort of re-traumatization to them. And I really think the most important thing is this trusting relationship that we can build with these patients. They're very vulnerable. They're very scared. So we need to avoid causing more fear, stress, causing them shame, or making them feel inadequate because of the situation they have gone through or how they have gotten in this situation. And we really just need to provide the best care possible, give them resources. If they're with their trafficker, avoid any sort of interactions that could cause them to be harmed further when they have to be released back to this trafficker. If we are not able to report our findings, if the patient denies or they're over 18 that they deny, we have no legal or ethical standing to report these. So we just really need to create that trusting relationship and be compassionate and sensitive to these victims and their situation, and just do the best we can to either help them out of the situation, or if they have to return to the situation and that's what they choose to do, we just give them the best care and give them hope that they can seek help and that they can get help when they are ready. Thinking about the ethics involved in human trafficking, healthcare professionals When deciding if it's ethical to report a suspected human trafficking survivor or victim, if the trafficker is the one we think that brought them in, we really have to understand the balance of good versus harm done if we report this suspected trafficking. Because sometimes these individuals, we will think we're doing good by reporting it. However, when they get back to their situation, they are blamed for these reportings, and as a result, they get beat or more verbally abused, more sexually abused, and so it's doing a lot more harm than good for them in those situations. So we really just need to think about that. And to do this, we can use a risk benefit analysis. And in order to do this, we utilize the ethical principles again of autonomy, non-maleficence, benefits, and justice. So when doing this, we have to understand four different things. We have to understand, does the reporting deprive the survivor from autonomy and making his own decisions? Like, for example, if the patient's like, I do not want to report this, that means they are not consenting. And if we do report it anyway, one, we're violating a breach of HIPAA, and also we are taking away their autonomy to make that decision, and they've had their autonomy taken away already from these traffickers. So we really need to consider that when we are reporting. Also, we need to recognize, does the harm reported in return reduce the potential harm, or will it increase the potential harm? And that goes back to what I was saying earlier, how the reporting could be the trafficker could retaliate against the victim. We need to understand the consequences of reporting. This also kind of refers to, will the victim be retaliated against, or will it do good? And then does the reporting create more harm or good? We really have to we really have to determine if good or harm will come from us reporting. If it's going to do more good, we need to report it. If it's going to do more harm, unfortunately, we need to just, unless they're under 18, because then it's mandatory. If they're over 18, we really just need to maybe let our supervisor know, but we don't report it to the authorities because we don't want to cause more harm or trauma to that patient. And if we do report and we decide that that is the best option, we need to ensure that the victim can be safely protected from retaliation of the traffickers. So whether that is giving them a safe place to stay through the police or keeping them in the hospital, we have to make sure they are safe if we report these. When deciding if it's ethical to report human trafficking, violates ethics across the world's population, and this is from denying human rights from an individual, including their freedom. They are either being forced to commit sex acts for valuables in return, either money, objects, etc., or they're being forced to work in terrible circumstances, whether they're too young to work, and this is called labor trafficking. And so either whether being taken into labor trafficking or sex trafficking, their human rights are violated and they no longer have freedom because their trafficker is their essentially slave master, and they have become a slave to this human trafficking. It also abuses power. Oftentimes this is shown through violence, whether physical or sexually, and this is to essentially groom's not the right word, but to essentially condition these individuals to not retaliate or try to run away, because they'll be more scared to do this, because they will be more vulnerable and understand that if they do try to do these things, that they will be retaliated against, and so they become more vulnerable and do not speak up for themselves or try to get out of the situation anymore. Also, human trafficking, whether for labor or sexual, exploits people for profit, and this is either working for free or working in terrible conditions, working for under minimum wage, or having to do sex acts for something in return and not seeing the return. Victims often experience physical, sexual, and psychological abuse, like I mentioned before, and this can result in like long-term health issues, especially depending on the age of the child, and it just leaves them with a lifelong health issues, whether they're rescued or even if they're still stuck in the situation. A lot of times they have health issues that are unresolved and untreated, and this just further complicates these issues. Victims lose the autonomy of their own bodies, either with labor trafficking, where they're forced to work, or with sex trafficking, they're forced to commit these sexual acts. And sometimes it's by the trafficker or by the customers of the trafficker. Also, victims lose the right to live a safe, dignified, and secure life. They are not secure. They do not feel dignified. They feel inadequate. They are degraded every day, whether verbally, physically, sexually, and they just ultimately aren't safe. At any given moment, they could be unwanted, unneeded, and either killed or just tossed to the side, unable to fend for themselves. And so really, all human rights are taken away for victims of trafficking, and this is across the nation and world. Ultimately, trafficking is rooted in systems of inequality. It targets the poor, homeless. Trafficking is rooted in violence in order to gain power. Oftentimes, trafficking is subject to women when it involves sex trafficking. However, men are also at an increased risk for this happening, especially younger men, and it's ultimately becoming more or less gender appropriated to women. And then also economic inequality. So those who live in unsafe areas, those who live in drug areas oftentimes are more prone for trafficking, whether they are an addict and they're seeking drugs and they get roped into trafficking in order to pay off their debts for these drugs or to get more drugs. And unfortunately, the environment in which an individual lives plays a heavy role on being a victim of human trafficking. And we just really need to help our communities be made aware of the risk in the vulnerable population and just the signs that human trafficking may be in play, and really just try to stop this from occurring in men, women, or in any vulnerable population. Human trafficking is a crime involving the use of fraud, force, or coercion to cause a person to engage in labor or sexual acts. Labor trafficking, according to Section 1589 of Title 18 in the United States Code, defines labor trafficking as obtaining labor or services from a person through actual or threats of force, physical restraint, serious harm, or abuse of legal process. Sex trafficking, under Section 1591 of Title 18 United States Code, defines sex trafficking as causing a person to engage in a commercial sex act through the use of coerce, fraud, or coercion, or by causing a minor to engage in a commercial sex act. Importantly, force, fraud, or coercion do not need to be present when a victim is under 18. The statute defines commercial sex acts as any sex act for which anything of value is given or received by any person. The statute criminalizes not only the individual directly involved in the act, but anyone who knowingly recruited, entices, harbors, transports, provides, obtains, advertises, maintains, patronizes, or solicits a victim of sex trafficking or labor trafficking. So this would be like companies and websites facilitating and supporting advertisements used in sex or labor trafficking, or customers of labor or sex trafficking victims. So essentially anyone who is involved, whether the trafficker themselves, individuals in the place where the trafficking is occurring. Sometimes we call these like trap houses these days, but the more legal term is like trafficking houses. When it involves sex, or like any other workers who may not be in labor traffic but still working for that company, they could be held accountable if they are aware of the human trafficking involved in these companies or persons. The United States has a few different laws in regards to human trafficking. A few of the main ones is first the Trafficking Victims Protection Act, the TVPA of 2000 is the primary federal law in the United States addressing human trafficking. The TVPA involves protection, prevention, and prosecution, along with providing immigration relief for foreign victims. It established the Trafficking in Persons TIP report, allowing a ranking of which countries combat human trafficking effectively, and they're able to use this data in order to determine what is working, what isn't working, and ultimately just help these victims. This act and law is not only helping the United States prosecuting the traffickers, but also in return helping the victims as well. Because it's good if you prosecute the traffickers, but these victims are still left with this trauma. And so even though there's a relief that the traffickers off the street, they still have a lot to deal with. The next one is the Customs and Facilitations and Trade Enforcement Act of 2009, which prohibits the sale of goods made by victims of human trafficking or through coercion. So, if something was made by, and it, was a result of labor trafficking, these items cannot be sold, and anyone who sells or buys these items can be prosecuted. The next one is the Trafficking Victims Protective Reauthorization Act of 2013, and this established emergency response provisions for disaster areas by the State Department. So this is the State Department responds to disaster areas and crises. So for example, hurricanes, tornadoes, floods, fires, especially 9/11 or these recent hurricanes we had. These people are vulnerable, and unfortunately traffickers will take advantage of this, and many people will be considered dead, but ultimately they were just taken by traffickers and taken out of the country or taken wherever, and now they are victims of human trafficking. And so they just send these people out so that way these people without homes now, without shelter, are not trafficked, and even more trauma on top of the disaster that already happened to them. Internationally, there is pretty much universal human trafficking laws, whether nationally, globally, whether in the United States and Europe, human trafficking is prosecuted at all levels in all areas of the world. But internationally, there's a Palomora Protocol, and this in Article 5. It requires individuals who have trafficked, attempt to traffic, or any other intentional participation or organization in a trafficking scheme, they will be criminalized. And another one is the International Covenant on Civil and Political Rights. It prohibits a number of practices directly related to trafficking, including slavery, the slave trade, servitude, and forced labor. So this involves mainly the labor trafficking aspect, but ultimately across the nation and world, the laws are very clear cut that trafficking will be prosecuted, and I think that's good. Although there are areas where trafficking is higher and these traffickers aren't being caught, there is laws and regulations surrounding what to do if trafficking is found out by law enforcement or others, and so I think that's a good guideline to use. However, human trafficking is still a vast unfortunate occurring in our world, and we really need to take time to notice the signs and do our job in reporting when we're able. When it comes to human trafficking, healthcare providers should be knowledgeable in when to report suspected human trafficking. So, Indiana follows the federal laws, and so any person under the age of 18, this is required to be reported as child abuse. So, you would report the suspected human trafficking under the guidelines of how you would report child abuse. So if the victim's 16, 17, and they don't want it reported, unfortunately, because they're under 18, we are legally and ethically bound to report this to the proper authorities. If the individual is 18 and over, healthcare providers are not required to report the suspected trafficking. So if the individual is saying, I don't want to report this, I'm afraid of what might happen, we are not able to report this information. We could possibly tell our nurse lead or our supervisor, or a physician could tell like their head physician, just in case that person does come in again. However, we cannot report this to law enforcement because this is a violation of their autonomy, which is ethically wrong, and then also their HIPAA, which is legally wrong. So we really have to understand these reporting laws and do right by our patient, and also do right by the legal obligations that we have. Whether a survivor of human trafficking believes in a certain religion or not, there's still spiritual needs that need to be met. And this involves any person who is a survivor of trafficking or who is being trafficked locally, in the state, nationally, or globally. And so these are guidelines that anyone in the world can use in order to help these victims who have been trafficked. So really, after a victim has been trafficked, even if they do not believe in a certain religion, religion and spirituality in general can be a source of support and healing for these victims. And oftentimes within the hospital setting, if they're seeking care after they've been rescued from these situations, chaplains are often the first people to encounter victims. And this is because they offer a safe and confidential space to seek emotional needs and spiritual guidance for these victims. And so oftentimes they'll open up more to these chaplains or a spiritual advisor because they feel more at ease with this. So some spiritual impacts from the abuse of human trafficking includes isolation from religious communities, loss of belief in their faith, questioning core values and beliefs, search for meaning and justice, feelings of divine punishment, questioning the value of prayer, and they really do need spiritual reassurance because they just feel lost from their previous spirituality or religion if they had that beforehand. So us as nurses or physicians or anyone who encounters really a victim or survivor of human trafficking, a lot of times they need spiritual assistance with meaning making. So oftentimes they're asking themselves, why did this bad thing happen to me? How did I let this happen to me? And they're just trying to understand why this would happen in their life. So really just helping them process that and walk them through it. We can't give them the answer to that question, but we can help them process it. Also, their purpose. So sometimes they think, why am I even here on earth? Like, if this was the life that I lived, or what happened to me, like, what is my purpose here? And oftentimes this leads into like depression, that no one really cares about me, nothing really matters, I don't have any interest anymore. And this oftentimes leads to thoughts of suicide, because if they don't have a purpose, if they were only brought here to this earth to be trafficked, then what is the point of even living here anymore? So really it's just our jobs to get them connected with the right people, if it's not us, to help them walk through these feelings, because they are real feelings. And unfortunately, many trafficked victims do have thoughts of suicide and go into deep depressions because they just can't understand why this would happen to them at times. And then also they have a moral injury. So even if they can get through the other aspects of being trafficked and make meaning of that, this can ultimately be used for good, they may have had to do bad things while they were being trafficked. And we just need to reassure them that this situation is not their fault. The things that they did are not their fault. And they were ultimately coerced, abused into doing these things. And so ultimately, our role in giving patients who have been victims of human trafficking to meet their spiritual needs is just connecting them with the right people, or just being a listening ear and giving them reassurance that this is not their fault. What
Hello, this is Lisa Decker. On the next 3 slides, I'm going to review personal issues with human trafficking and the incidence of human trafficking, covering local, state, national, and global issues. Starting with personal issues at the local level, first we'll talk about how victims go unnoticed. Victims, whether minor or adults, go unnoticed due to lack of awareness in the community, where people do not recognize the signs of trafficking. Additionally, many times victims are groomed by the trafficker, and slowly the trafficker becomes part of their life, decreasing the chance that someone in the community recognizes human trafficking. Second, victims remain in exploited situations longer due to unknown support systems and lack of local support. Many communities, especially rural areas, do not have sufficient local resources or organizations to help victims. Without the ability to get safe shelter, legal assistance, counseling, or help for themselves and their family, victims feel hopeless and remain with the trafficker for basic needs, housing, and food. Third, many victims distrust authorities due to previous negative experiences or threats directly from the trafficker. As an example, a person trafficked for labor at a local business will avoid any opportunity to report the situation to police due to threats from the trafficker that they will be deported, they will be harmed, or that their family will be harmed. Fourth, survivors have difficulty finding employment and to find good relationships due to lack of services to help them reintegrate into society due to facing stigmas in the community. Social stigmas, especially from sexual exploitation, can lead the survivor to feeling ostracized. When survivors are unable to get services such as counseling, they have difficulty returning to school or finding jobs, as they may feel judged by community members. Next, I'll cover issues at the state and national level. The first issue at these levels is that there is inconsistent legal protection from law enforcement across the states. Although the United States has enacted federal legislation such as Trafficking Victim Protection Act, it is not implemented or enforced the same in all states, and not all survivors will receive the support and protection needed from these laws. Second, there is fear of deportation, as many victims are undocumented immigrants and will not try to seek help due to immigration status. As mentioned in the local issues, the same applies here, where many victims are immigrants and are not aware or not able to get help from laws such as Trafficking Victim Protection Act, which offers legal residency to trafficking survivors. But when unaware of these laws, or when these laws are not implemented, the survivor is too afraid to try to leave. Third, even in states where the laws for victims are well funded and supported, because many victims are minorities, there is lack of seeking help due to language barriers. Fourth, the process for legal compensation is lengthy. There is legal compensation for survivors in the Trafficking Victim Protection Act, allowing survivors to be paid by traffickers. But because the legal process is lengthy and complex, it leaves the victims waiting years to receive any compensation, or sometimes traffickers are not financially able to pay restitution, leaving survivors without financial support needed to rebuild their lives. Issues at the global level include economic exploitation. In many parts of the world, the marginalized populations such as ethnic minorities, women, children, and refugees are largely targeted by traffickers. Traffickers exploit economic inequalities to trap victims in debt bondage. In these situations, victims seek economic opportunities, then are forced to work off a debt. The debt continues to grow with exorbitant interest rates and fees, keeping the victim in debt bondage to the trafficker. Second is the lack of justice and protection due to corruption within law enforcement and government. An example is in certain regions of Africa and Asia, traffickers often bribe local officials to avoid prosecution for their involvement in these illegal activities. This causes victims to struggle and not have access to legal justice and protection. Third, political instability in conflict areas cause limited ways for victims to escape or find protection. In conflict areas, traffickers take advantage of political instability and the breakdown of law and exploit the vulnerable, causing the victims to have limited ability to escape and find protection. Fourth, in some countries, cultural attitudes are directed at the victims. In these societies, women trafficked for sexual exploitation may be shunned or ostracized by their family and the community, making reintegration nearly impossible. This isolation can keep victims with the trafficker. Many issues overlap and are the same at all levels. This includes reintegration into society due to lack of funding. Survivors face challenges finding good housing, education, and jobs after escaping. There are national programs in place to help survivors, but there is lack of funding, leaving many survivors without the help needed to rebuild their lives. Also, we need to address lack of health care. Victims often lack access to basic health care while with the trafficker and after escaping. As an example, migrant workers trafficked for labor such as agriculture or construction may suffer from injuries, dehydration, or exhaustion, but are denied medical attention due to cost as traffickers prioritize profit over care of the workers. Survivors often do not know how to access funds or have funds for health care for themselves or their family. There is also inadequate mental health services. Survivors often suffer severe psychological and physical trauma, including physical and emotional abuse, neglect, and deprivation. Most survivors struggle to access adequate health care and mental health services to recover from these traumatic experiences. Mental health challenges include PTSD, depression, and anxiety, which can affect the ability to reintegrate into society and trust others. Looking at the incidence of human trafficking in 2023, first we'll look at the state level. In Indiana, there were 110 cases identified in 2023, with 185 victims, as each case involved multiple victims. On the national level, there were 9,619 cases identified in 2023, with almost 17,000 victims. These statistics are reported by the National Human Trafficking Hotline. On the global level, the incidence of human trafficking was nearly 50 million people in 2023, with 20 million in Asia and the Pacific, 7 million in Africa, 6 million in Europe and Asia, 5 million in the Americas, and 2 million in Arab states. These statistics were reported by Walk Free.
Looking at local prevention in Allen County, Fort Wayne specifically, on human trafficking,
there is an Allen County Human Trafficking Task Force. The task force is actually part of a larger Indiana Protection for Abused and Trafficked Humans. This is also known as IPATH. Their initiative is to work closely with local law enforcement, federal agencies, and not-for-profit organizations, investigating and trying to combat human trafficking in the areas. Fort Wayne Police Department participates in this effort with the IPATH to combat trafficking, doing so by collaborating, allowing for better resource sharing, specialized training with surveillance practices, and how to respond more appropriately to trafficking situations. Another resource in Allen County is the YWCA of Northeast. This is actually a domestic violence shelter for women that provides services such as crisis intervention, counseling, housing, and legal support for those affected or vulnerable to trafficking. Also, there are local safe houses and shelters in Allen County which are trained in human trafficking education. These provide safe environments, everyday resources, and access to care. In Fort Wayne specifically, there's quite a few. To list some, there's the Rescue Mission, the YWCA, which we talked about, Vincent Village, and Just Neighbors Interfaith Homeless Network. There's also Amani Family Services. This helps those of social determinants of health, being immigrants and refugees. This increases the risk of them being victims to human trafficking, so they provide resources. These combined efforts in Allen County, Fort Wayne, reflect a proactive approach to both preventing human trafficking and providing critical support for those affected. Looking at the state of Indiana, specifically in human trafficking for prevention, there are anti-trafficking laws in place distinguishing between sex and labor trafficking, both which carry severe penalties. So under Indiana Codes 35-42-3.5, these penalties can range from different levels of felonies depending on the severity of the crime. For example, if minors were involved or if there was injuries or death, then the felony charges are going to be obviously higher, a level 1 or a level 2, putting them in prison longer. Within these laws, there are safe harbor laws that protect for minor victims in Indiana, ensuring that these minors will be looked at as victim rather than criminals for crimes that happened. Looking ahead, there is, we talked about it earlier, the Indiana Protection for Abused and Trafficked Humans, IPATH, which is an organization that helps with resources and education for law enforcement. A part of this with training includes, it's called sting operations and surveillance. This works with like the FBI and Indiana law enforcement. This targets big events that traffickers might be attracted to because of crowd control and all that. Events such as like festivals, concerts, conventions, and something big in Indy, the Indy 500. So kind of co-chairing with the IPATH is called Indiana Coalition to End Sexual Assault and Human Trafficking. This was formed in 2004 after the U.S. Justice Department reported that Indiana was at high risk due to the specific location with the number of intersecting national highways. This coalition works with jobs like hotel industry and transportation systems on how to spot potential trafficking and report it. An example of this is called the Truckers Against Trafficking program that equips truck drivers in identifying and reporting this, which we'll kind of talk about later when we go into the national level of prevention. All right, moving on to national prevention for human trafficking. There's actually quite a bit here with laws, campaigns, and organizations in place. Looking at U.S. Department of Homeland Security, the Division for Center for Countering Human Trafficking, their mission to increase law enforcement operations to protect victims and enhance preventative efforts. Doing so with like national campaigns, such as like the biggest one being the Blue Campaign. With this, partnership with like organizations, law enforcement, state and local authorities to help maximize national public engagement with the anti-human trafficking efforts. Their biggest month for this being in January is dedicated to human trafficking, but there's actually a specific day, which is January 11th, which is National Human Trafficking Awareness Day, where everyone's encouraged to wear blue to help raise awareness. And then there's also several like special events and media coverage, like with the news and like educational activities for engagement with the public. There's also a National Human Trafficking hotline that's available 24/7 to anyone. This can be with like reported anonymously, or not, but basically anyone can call this, like victims, law enforcement, and concerned citizens that might suspect any kind of trafficking. The number is listed here, but it's 1-888-373-7888. There's actually options to text or chat virtually. Next one here, kind of talked about this one with the state prevention, but Truckers Against Trafficking, also known as TATE, is an organization that collaborates with the U.S. government to train truck drivers to recognize signs of trafficking on the highways and report it, since they're really the eyes and ears of the roadways, being their job, constantly go, traveling to different places. They might see some things. This has been established since 2009, and per their website and their 2023 report, there was actually 1,745,803 people trained with this TAPE program, which actually increased by 15% since 2022. Which is very significant and great. Next is called Trafficking Victim Assistance Program. This was enacted in 2000, and this is a legislation that was established for human trafficking to be a federal crime, and is combated through the 3P approach, which is prevention, protection, and prosecution. Prevention with like funding, public awareness campaigns, and mandating training for like federal employees. Protection with trafficking survivors with access to like resources such as like a T visa, allowing them to stay in the U.S. longer while they're assisting in the prosecuting trafficking, their trafficker. And then prosecution, which enhances like legal tools to prosecute the traffickers. And then lastly, we have the Prevention, Sex Trafficking, and Strengthening Families Act of 2014. This is a law that aims to prevent child trafficking by ensuring that state foster care systems have policies in place to identify and protect children at risk for trafficking, especially those who are in foster care. Lastly, we will be looking at human trafficking at a global level with prevention. So here, the U.S. Immigration and Customs Enforcement, also known as ICE, particularly through the Homeland Security Investigations Division, plays a key role in preventing human trafficking globally through like border control and security. With border control, ICE actually monitors borders to prevent traffickers from moving victims internationally, specifically at entry points into like other countries by land, sea, and air. ICE investigates and enforces attempts to dismantle trafficking networks with conduction of like rescue operations and arresting. Next, looking at Interpol, which is an international criminal police organization that plays a role in preventing and combating human trafficking with coordination with international law enforcement, facilitating like intelligence sharing with cyber investigations and conducting specialized operations. Interpol collaborates with global networks in law enforcement, and which provides a platform for all their countries to be able to share information and intelligence in like real time. Interpol actually puts out alerts and notices called like red notices and yellow notices. The red notice is for individuals that are actually wanted for human trafficking and alerts the country of where they are, so it's easier to expedite the arrest. And then yellow notices are for like local missing people, especially minors that are possibly involved in trafficking, to look out for. Interpol also targets online trafficking with like the dark web monitoring. And then lastly, we have the International Organization for Migration. This plays a significant role in prevention of human trafficking through promoting policies that address the root causes of trafficking, working with international bodies, advocating for like anti-trafficking laws and promoting awareness. The IOM promotes safe migration practices with providing information to migrants with like pre-departure orientation and legal assistance to reduce, because they're vulnerable to exploitation and trafficking, to help reduce the numbers of this. Looking at how human trafficking affects professions, professionals in jobs like healthcare, education, social services, law enforcement, government officials, educators, hospitality, and transportation all have an ethical duty to act when they encounter potential signs of human trafficking. Looking at medical professionals, they play a vital role in identifying and assisting trafficking victims who may come and seek medical care for injuries, illnesses, sexual transmitted infections, or mental health issues, making it an ethical duty as a healthcare provider to be trained in signs and symptoms of different forms of abuse and knowing how to report this. This is probably going to be seen more like outpatient clinics or ERs, especially in bigger cities, especially. Next, looking at law enforcement and government officials, often these are the people that are on the front lines of combating human trafficking. They're the ones investigating trafficking cases, arresting traffickers, and supporting the victims after the fact. Putting policies and laws in place for regulation at the local, state, and national and global levels. Legal advocates or like social services, they provide crucial support for victims, helping them to navigate the legal system, obtaining those protective orders, also helping them to access different resources they may need, like shelters, rehab services, and so on and so forth. Educators playing a huge role in educating children at the school age or adults in college about human trafficking, and especially monitoring those who might be at higher risk for human trafficking due to the social determinants of health. Just kind of keeping an eye on them and reporting anything if they notice. Hospitality and transportation services. These are professionals in like travel and hospitality industries, which can help to identify trafficking victims by recognizing the red flags in their customers' behaviors, with interactions and things and reporting this. Kind of talked about with prevention a lot of this in the last 2 slides, but kind of with the truck drivers and those in the transportation service or hospitalities with like hotel services and things like that. But yeah.
We must help advocate for these victims by raising awareness to recognize and help victims through education, educating yourself and sharing information, partnering with local schools, churches, and organizations that have advocacy programs or help develop programs within local organizations, and partner with national and global organizations. We need to report suspicious activity to local law enforcement and the National Human Trafficking Hotline. We need to support services for survivors and organizations, either financially with personal donations or organized local fundraising. Also, volunteering with local, national, and or global organizations, giving our time to help raise funds. We need to support ethical brands. We need to find out information about brands that we buy and look the information up on different websites. This includes Ethical Brand Directory. After we find out about what brands are ethically sourced, we need to choose to buy these ethical brands and educate others on these brands so we can put a stop to labor trafficking. We also need to support policy changes that adopt and strengthen laws for human rights, and to lobby for legal reform by writing letters and signing petitions that advocate to strengthen human trafficking laws. Through all this, we can help advocate for victims of human trafficking.
Within the healthcare system, it's important to have potential interventions for encounters with victims of human trafficking, and this is universal and can be used locally, by state, nationally, or globally. So the question is, how can healthcare professionals intervene in human trafficking? So ultimately, the staff need to be educated. There needs to be trainings in order to identify signs of human trafficking, and then in return, how to respond to these signs, and when human trafficking is suspected, when to report, when are we mandated to report, is it ethical to report, is this going to do more harm than good? Just the staff needs to be fully educated on all aspects of taking care of these victims. Next, we need to create a safe place. So the environment that we work in needs to be non-judgmental. So this means with each patient interaction, no matter what they come in for, whether it's for a drug overdose or alcohol abuse, we need to be clear from biases, clear from judgment, and really recognize signs. If we have a bias towards these individuals, we are already brushing them to the side, and we are not going to be aware of signs that human trafficking could be a factor into their addiction. So we just really need to be careful of that. Also, healthcare systems need to develop a plan. So the plan needs to include how to alert the proper authorities, how to intervene without causing escalation. So this would be like, how would you report it without causing more harm to the victim? And then how to protect the safety of patients, staff, and victims. So we do not want the victims to be retaliated against. We don't want the staff to be in jeopardy. Also, other patients on the unit. If that trafficker comes in for the one patient who is being trafficked and finds out that it was reported or such, there could be retaliation, and we don't know what that would look like. So just want to keep everyone safe. Next, we want to connect survivors with resources. We need to know the resources available for these victims and survivors. I say victims a lot, but we really need to call them survivors, because they are survivors of this tragic event, and we really need to give them empowerment. So using survivors is a better word, just for reference. But anyways, there's tons of specialists, whether spiritual advisors, chaplains, religious advisors, and just there is people trained in helping victims of or survivors of human trafficking. And so we really just need to know where those resources are so that we can get these survivors in contact with them. Also, if a survivor or a victim at the time comes in, so if the trafficker brings them in due to an injury, we need to find a way to give them a number to contact when they are able to without causing harm to them. Next, we need to prioritize the trauma-informed care, which I had mentioned earlier underneath the ethics slide of how to care for them. And then, again, with reporting, we need to know the proper authorities. We need to know the National Human Trafficking Hotline, which is in a few slides. And then we need to partner with the community. And again, this just comes back to developing relationships with local partners such as law enforcement, child protective services, and victim services agencies, and just knowing these people, these resources, and just really being able to intervene when these survivors or victims come into our units, into our hospitals, and just being able to make them feel empowered, make them feel like they can get control back over their life through these resources that we are providing and the care that we are providing to them. And so really the interventions come down to how we interact with these survivors and the impression that we leave on them. Do we leave an impression of hope, or are we leaving an impression of they are never going to get out of this situation? Within the healthcare system,
In conclusion, human trafficking is modern-day slavery. It is a complex issue that does not discriminate. It affects individuals, families, communities, and society at every level from local to global. It violates human rights. It violates ethical principles, specifically autonomy. Even though there has been progress on human trafficking awareness in the last 10 years, much more needs to be done to prevent human trafficking and improve outcomes for survivors. Addressing human trafficking requires a multi-level approach involving legal reforms, public awareness, coordination of law enforcement, and victim support at all levels. The general public and professionals in healthcare, social services, law enforcement, government officials, hospitality, and transportation workers need to be aware of human trafficking. They need to know what to do and how to help these victims. They need to work together to stop human trafficking.